Welcome to the Help We Need podcast, where we explore topics that empower women and support their well-being. I'm your host, Fumike Murunkeji, and in this episode, we shall delve into the interesting world of Ovarian Reserve and the IVF procedure as part of women reproductive health care. Today, joining us is our guest speaker, Dr. Marta Luque, a licensed IVF fertility consultant with over 15 years of experience and a practicing consultant on women's reproductive health care at First IVF Clinic. We're so glad to have you today, Dr. Marta. Thank you for joining us on this part one series of our episode on women reproductive health care. Of course, today we'll be talking in detail about Ovarian Reserve.
Thank you so much for having me today with you.
Absolutely, and we're so delighted to have you join us. So, Dr. Marta, let's start with the basics. What is Ovarian Reserve, and how is it connected to female fertility?
I would like you to imagine that we are born with a certain number of eggs. It's like a box full of eggs, and we are not going to produce anymore. So we will have to manage our fertility with this box full of eggs. And I want you to imagine that every cycle, every month, we are taking a few number of them out of the box. From this group of eggs that we have taken out from the big balls, only one of them will carry on growing to become a mature egg that will be released during our ovulation, and the rest of them will disappear, will die. We discard them. And that's the reason why the number of eggs remaining in our box declines over time. So as we get older, the number of eggs will be less and less and less and less, and also the quality will decline, because at the end they are going to be the same cells that had been there with us for 15, 20, 25, 30 years. So quality will decline. And this is why trying to take control as much as we can of our fertility can help us in future if we are not ready to try for a baby right now.
It's really very helpful. I like the way you described it as a box, and that with each monthly circle, we're taking out of the box. Yeah, so that's
and one thing that is really, really important is that regardless you are pregnant, you are taking the contraceptive pill, that is not saving us from taking out this group of eggs coming out from the big balls every month out. So even if we are taking the contraceptive pill, every month we are discarding a number of eggs. The only thing we are doing is that we are not letting any of them grow to become a mature egg. So we do not ovulate. Because some or many ladies out there, they think that they are keeping the eggs because they are taking the contraceptive pill, for example, but it's not like that. And still, the ovarian reserve, the number of remaining eggs is declining.
Oh, that's really very enlightening. So maybe let me move over to the part where we are assessing the fertility, right? So now we know that we are kind of depleting the resource until God knows whatever. So maybe in terms of trying to understand for some of our women out there, what age would women be at their peak in terms of fertility? And what age do you consider that maybe it's really declining, and as women, we're really we really need to be aware that we might not be so fertile anymore because the egg reserve, like you said, is going down?
Yeah, so basically we are designed to have kids ideally in our 20s. Biologically, we're designed to do that. Okay? So ideally, the best moment, or let's say the best age for us to have kids is in our 20s. But obviously, socially, based on the personal goals, career, studies, university, being financially okay to think about that, these days is leading us on our 30s. But from the fertility point of view, the moment we are around 35 years old, I want everyone to understand that our ovarian reserve, in terms of number and quality, declines exponentially. So really, really fast from that moment onwards. So this is the important thing. Biologically, even if we look amazing on our 30s, and we do, or even our 40s, biologically, we are designed to have kids in our 20s.
Okay. But I do know that certain women do have kids much later in life. So maybe where this question would probably be very important for us as women listening is, how can we assess? So I've heard that there are testings that could be done
Yes.
to be able to assess ability. So could you just walk us through that a bit and help us understand what do we need to do, for example, to test for this, and
Yes.
what would be the most optimum time to do that?
Yes. So basically, we have two tests to assess someone's ovarian reserve. One of them is doing one ultrasound that we do at the beginning of the cycle. The beginning of the cycle is always a period. Okay, that's the moment everything starts. So in the first 2, 3, 4, 5 days, if we do an ultrasound, we can see how many eggs have been taken out from the box. So we can count them. Obviously, we cannot see the eggs, okay, because they are just one cell. But every egg is like inside a bag that we call it a follicle, okay? And we can see the follicles. So the test we do is called antral follicle count. So we can see exactly how many eggs have been taken out from the box that particular cycle. So the ideal moment to do it is first week of the cycle. The second test is a blood test. It's assessing the level of a hormone that we call it anti-Mullerian hormone, AMH. Okay? AMH is produced by the cells in this follicle. So the level of AMH is correlated to the number of follicles we have. So the more follicles we have, higher AMH. And AMH, the advantage over the ultrasound is that it can be done any moment of the cycle. So these are the two tests that we usually do to assess someone's ovarian reserve. Once we have the result, okay, has to be understood depending on everyone's circumstances. So not everyone is the same. So certain level of the AMH is not the same if we are 25, 30, or 35. So this level can be very low for a 25 years old lady and can be amazing for a 42 years old lady. Or depending the background, depending if you have a previous ovarian surgery that we know will have an impact on the ovarian reserve, maybe keeping in mind that you have that kind of surgery is still a nice level, but it's very low for someone that didn't have any surgery. So it's not an absolute information. It has to be understood depending on everyone's circumstances.
That's really helpful. Initially I wanted to check with you, for those of us listening in, just for the benefit of doubt. When you say circle, what do you mean? Said at the first two or so certain days of our circle. So what do you mean by circle?
So the cycle is the period that we start here when we take this number of eggs out of the box. It will take, in an ideal cycle, around 2 weeks to get one of them mature and be released around our ovulation or during our ovulation. Okay? And then we have another 2 weeks. If there is an embryo that will implant, will give us a pregnancy, so no period will come. But if there is no pregnancy, okay, we'll have another period and everything starts from the beginning. What is another thing important for you to understand? What is the period? At the end, when we bleed, it's just our internal layer in the uterus, in the cavity of the uterus. We build a new one every cycle. So again, we have a period. That means our lining, our endometrium, the internal layer, is coming out because there was no pregnancy. From that moment onwards, the ovary is getting the egg ready to be released, and at the same time, we are building a new lining, getting ready for that embryo to implant. If there is no pregnancy, we'll get rid of that lining again. So it's like every cycle, we have one new egg, one new lining. And this is a cycle, ideal cycle, or British time cycle, 28 days. So we start, day one is first day of the period, 14 days later, more or less, we ovulate, and if there is no pregnancy, 14 days later, we start another period. Sometimes it's not 28. So what we consider normal is cycles between 25, 35 days. It's still in the normal range. Anything shorter than that or longer than that, maybe it's giving us an idea that maybe ovulation is not happening as should be, or can give us, then we need to investigate a little bit more.
Okay, great. So in summary, there are two specific tests to assess our ovarian reserve. We have the ultrasound test that is done, and there is also the blood test that could be done at any moment of the cycle. And these two tests will give an accurate idea about the ovarian reserve. So that's very, very enlightening. Thank you so much for providing so much details around the cycle and how obviously that works. So I'm going to come in with the question of egg freezing now. So depending on circumstances, why do women freeze their eggs? So, and maybe what could be helpful for women listening in on the call, or maybe as a reason to maybe you need to freeze your eggs if it's not small.
Why? Yes. Why is it worth it to consider to freeze the eggs? Because as we said before, the ovarian reserve will carry on declining, no matter what we do. Obviously, the better we take care of our body, so that means healthy lifestyle, exercising, healthy diet, the better our eggs are going to be. Exactly like our skin, our heart, our brain. Okay? They will be in a better condition. But still, it will carry on declining. So maybe we are facing a medical condition that will reduce or will decline faster our ovarian reserve, such as a lady that needs to have an ovarian surgery. She has a big ovarian cyst. Already, imagine we have a lady with an ovarian cyst around 10 centimeters. Most probably think that cyst, already growing, has destroyed part of the normal eggs. But at the same time, doing the surgery, even if we are really, really careful and we try to be, but it still is going to have an impact on the ovarian reserve. Or a lady that will need to receive chemotherapy because it has an oncological process, like the most frequent one, breast cancer, lymphomas, leukemias. So all these drugs will kill the bad cells, but it's going to kill also the good ones. Benign medical conditions, endometriosis. So there are so many medical conditions that we might be having already an indication to tell the lady, look, let's freeze some of your eggs because this is going to have an impact on your ovarian reserve. And sometimes there is no, it's just that we are not in the right moment of our life to try for a baby. Based on very personal situations like, yeah, I want to, but I don't have the right partner right now. And I don't want to rush things because sometimes a pregnancy is not going to solve personal issues. And sometimes it's worse the solution than sometimes because you have to be focused on your career. So yes, always from our side, the first message is going to be, I want you to understand this. Ideally, we should have babies in our 20s, but we cannot control the society. We cannot control how things are designed. I'm pretty sure all these things will change over time. But right now is what it is. We have the pressure to go to university, to start our career. It's not easy sometimes, to carry on with your career and thinking about having kids, because many times we'll pay a toll because of that. So 15 years ago, there was nothing we could do about our fertility. These days, we can freeze some of the eggs. Depending on our age when we do that and how many eggs we are going to be able to freeze, we'll have a probability to have a child with those eggs. It's never 100%, okay? But something is always better than nothing. And what I always tell every patient that comes to have this conversation is, it's great that you are going to freeze some of your eggs, and the best thing for you to happen is that you will never need them in future. That means the moment you try for a baby, you get pregnant. But don't think about it like if you are wasting your money or your time. I always tell them this, or give them the same example. No, this is like having the insurance for your car or for your house. Best thing for you is that you will never need it. But if you need it, you are going to be so happy that you got it.
That's so true.
Exactly.
So
because if at the end, if you are going to need them, the younger those eggs are, the better results we are going to have.
Okay, thank you. That's really very helpful. And I like the way you've compared it to insurance, right? Because most of us on the call have health insurance. Some of us who drive obviously must have a car insurance. And for some of us also, we do have life insurance. It doesn't mean that we'll have an accident or, we'll die, but just in case. And this is what I hear you say. So just in case you may need it, it will be helpful. So could you just quickly walk us through the process? So if someone is interested, for example, in freezing their eggs, what are the key things that could happen in that process? If you could just quickly highlight for us so we get an idea of what that looks like.
Yes. So basically what we are going to do, remember what I told you, that every month, every cycle, we are taking the big balls and we are taking few of the eggs out of the box and only will carry on growing. So what we are going to do, we are going to give that lady, obviously, hormones, trying to make the rest of the eggs that have been taken out, to make them also grow, not only one, as many as possible. So hormones, because sometimes we are really scared when we listen to that word. And at the end, we are going to give you the same hormone that your brain is producing. Every month, we all of us, we have a hormone produced by our brain telling the ovaries, come on, release one egg. So we are trying to have more than one growing. So we will need to give you the same hormone, but higher levels. Annoying part that still these days, the only way we have to give that hormone is subcutaneously. That means these are the famous injections. Okay? There is no tablet, so for most of the patients, it's going to be through injections. It's like insulin for diabetic people. Still, they have to do it with injections. Injections are very easy to be done. Most of the patients, they learn how to do it. And if not, they can always come to the clinic every day. They will need to be, we start from the beginning of the cycle, so second, third day of the period. On average, they will need to be on medication around 10 days. That's what it takes for the eggs to be ready. In between, we'll see the patient like 3-4 times to monitor how the eggs are growing, to making sure that everything is progressing as expected. After this, around 10 days, the eggs will be ready, and we'll do the egg collection. Egg collection is a minor procedure that we do in theater under sedation for safety reasons, not because it's very, very painful. It's not painful. But basically, we do it, it's like doing an internal ultrasound, a vaginal ultrasound. So we attach a needle to the probe, and with the needle through the vaginal walls, we'll reach the ovary. We aspirate the fluid from those follicles, and that fluid will be given to the embryologist that will look for the eggs under the microscope. So at the end, we are going to be with a needle inside the pelvis for just 5-10 minutes. So we don't want the patient to move for safety reasons. Okay, so patient will be sleeping for 5-10 minutes. And then we finish. Then we usually keep the patients like between 1.5, 2 hours until we are happy to send them back home. That's the only day we will ask them not to go to work, just to come, do the procedure, and then just to go back home and take it easy that day. Following day, 98% of the patients, they are fine to carry on with their lives. The eggs will be already frozen, and that's it. We can keep them years. Quality of the eggs doesn't depend on how long they will be frozen. Always, let's say the stress for them is the freezing and the thawing process. So how long in between, it doesn't matter if they are going to be frozen 1 day or 10 years. So it's like a 2 weeks process. Where you can carry on with your normal life, minor advices, but easy things. And only 1 day we will ask you not to go to work.
Thank you so much for elaborating. I think that's really helpful. And I think I heard you say that they may be sleeping through the process for those people that are a bit scared of needles and feel like it's going to be painful. It doesn't sound like that's the case, right? If I heard you correctly. So it seems to be a seamless HV process. Did I get that correctly?
Most of the patients, when they come, they are scared about the needles, injections. Yeah, that is a reality. But honestly, I would say 99% of the ladies, they are fine. At the end, they say, oh, it wasn't that bad. It's not a big thing. It's not difficult. Injections are not difficult, honestly.
Well, that gives me a bit of relief. So I'm so glad that you said that. And I'm sure some of the women on the call are like, oh, thank goodness. So thank you for sharing that. That's really helpful. Now, I know you talked about, the extracting the eggs and then freezing the eggs. I can imagine that there will be a cost to this because obviously the eggs would need to be stored for whatever time that the lady may require or ladies may require to want to use it if they have to. So I'm just wondering, from a cost perspective, could you give us maybe an example of what that would look like? And I know a lot of people are listening from all over the world, but if you could just help us understand from a cost perspective, what does that look like?
Yeah, it's not a cheap procedure, obviously, process. The cost obviously is going to be different from one country to another. And why they are not cheap? First of all, because these kind of injections, they are not cheap. It's quite an expensive medication. And then because the egg collection process is a surgical procedure that has to be done in a theater. That's already an expensive thing to do. It's like if you are flying on a plane. Even if it's a 30 minutes flight, it's not going to be cheap because just the fact to put the plane up there is expensive. So to give you an idea, for example, here in Dubai, you can find clinics that will give you the service from 15,000 dirhams to 21, 22, 23,000 dirhams. Why this range? You have to read the small letter. Because at the end, the cost is going to be more or less the same in all clinics. The difference with the initial cost is usually if the medication is included or not. So these are the details that you have to pay attention. Maybe the 15,000, is telling you that, but it's not including the medication that you will pay separately. But this is to give you an idea. This usually is to do the whole process and to keep the eggs frozen for 1 year. Then every year you have to renew the consents and pay the maintenance fee for every year. But the maintenance fee is usually not a big thing. It's like around 2,500, 3,000 dirhams per year, more or less. So obviously it's money. I'm not saying it's not money, okay? Mm-hmm. But it's something that, it's like the insurance for your car.
So it's worth the while, given that you want to be, when you're ready, at least you know that there's something to use, right? As opposed to just finding out that your eggs are no longer viable, that would be disheartening. So what I hear you say is it differs, the cost would differ from location to another location or state or country, even the procedures. So I think it's helpful for women listening in to discuss these steps or procedures directly with their healthcare provider in line with the requirements of their state or country or jurisdiction. So thank you so much, Dr. Mata, for just clarifying more on that. So I think in terms of just wrapping up, what would you say to ladies thinking, maybe this is not really for me, or it's good information. I don't really need to take this into consideration. It's not my cup of tea. It's not my kettle, whatever, good to know.
Obviously, the final decision to proceed or not with egg freezing is very personal. It's very, very personal. But I think it's always worth it to check where you are in terms of how your ovarian reserve looks like, to get full and detailed information from the medical point of view about exactly the process, to have an idea about how many eggs you are going to be able to freeze more or less, depending on your ovarian reserve, depending on your age. You can make a decision if it's going to be worth it for you. Also, having the legal information. Because, as we said, costs are different from one country to another, but also the legal part. So not all the countries will let you do the same things with those frozen eggs in terms of if you are married or not, these things. So I think it's always worth it based on age, ovarian reserve, which country, your life plan, I don't know, to get all the information, and then you will decide. Obviously, this is, we are not going to tell anyone, look, you have a cancer, if you don't do it, you are going to die. It's not like that. Nobody's going to die. Obviously. So what we feel sorry is that till I would say 2-3 years ago, there was no awareness about ovarian reserve, egg freezing. So we are working on this so much because we've seen so many ladies coming when they are 38, 39, 40, 41, 42, just telling us, and when we give them bad news about ovarian reserve and chances of getting pregnant or results with fertility treatment, and they always say the same, nobody told me, I didn't know. And yeah, as I told you, 15 years ago, there was nothing we could do in a preventive way. But these days, there is something. So we can give you information, and then you will decide what you want to do.
That's so
it's
true.
Simple, but I think having information is not going to make any harm to anyone.
True. And yeah, that's so much truth in what you said. And we thank God that things are advancing each day, and technology, medicine is advancing in a way that it's helping to save lives. So what I hear you say, and I think it's helpful to just repeat it for ladies thinking, good information, not for me. So what I can hear you say is, your personal circumstances, my personal circumstances would most often dictate the decisions we make. But based on the information that you've shared today, which is very, very vital, I hope it empowers you ladies out there listening to make the key decisions about your own fertility, make the decisions that work for you. So this is really, really very helpful. And thank you so much for educating us all on this very crucial topic. I think at the end, ultimately, like you mentioned, the decision is left for every woman listening in to make or not to make. But knowing for ourselves or even our loved ones hopefully makes us make those decisions without any regrets. Thank you so much, Dr. Martha, for your time today. The discussions were enlightening and very educative. And while I would have loved for us to continue, we'll have to wrap it up for today. But do stay tuned in, because there's a part 2. Part 2 will discuss more about how the Ovarian Reserve or egg freezing connects to the IVF procedure, how we may navigate some ethical or legal implications. I had to talk about legal rights, as well as some religious or moral considerations, and maybe share some success stories. So maybe ladies can lean in more on that as well. So what would you have as a final say for us today before we close out, Dr. Martha?
First of all, thank you so much to give me the opportunity to continue creating awareness about the ovarian reserve. And second, I would be happy if you just take home the message that you understood what the ovarian reserve is, that to test the ovarian reserve is very easy. We'll give you very honest information about the process, what is involved, chances in future with those frozen eggs. And with all that information, then you can decide if you want to proceed or not.
Thank you so much, Dr. Martha. Thank you, everyone, for staying tuned in. I hope, like me, you're really excited for the next part of this episode and what we shall learn together. Don't forget to tell your family and friends and associates about the Help We Need podcast as we explore together on living our best lives. Until next time, stay empowered and remember to empower her.